on the global assessment, which means that it is one step below pandemic.
All right, we're already at pandemic levels. They are not reporting it. My wife Jennifer finally is like, oh my God, this is getting serious. We had our first death in the United States.
Actually,
well,
that's not what I said.
Who didn't know that?
I literally just looked up COVID-19, and that's the first article that popped up because it was the most recent from 14 hours ago. And then, oh snap! Ah! And then, and then I just looked up whether or not dogs could get it since we got 87.
And dogs can get it.
That's not what it said. It said it tested weak positive in its nose and mouth, probably because of environmental exposure. Not to say that the dog actually has the coronavirus.
If you have dogs, you need to euthanize all of them right now.
So rude. So rude.
So anyway, we had our first death, and it is amazing to me. And I want to thank Miss Grace for sending me a couple of videos this morning. People are already panic buying in, I believe it was Washington, Pennsylvania, and Hawaii. So, like we were sitting here talking, the coronavirus really doesn't bother me and worry me. It's the civil unrest that's going to come with it. It's the panic that's going to happen.
Oh, and it's
because most people are not prepared.
It can survive on surfaces from a few hours
to 9 days.
To a few days.
No, they said 9 days. I've read articles up to 9 days.
Okay, well, it say few in what I'm reading.
All right, so make sure you're washing your hands all the time. Make sure you are, not touching your face like I'm doing right now. And I discovered yesterday I touched my face like the average person touched their face 500 times a day. I touched mine 2,000 times a day.
No, I think the average person touches their face 2,000 times a day. Let me look. Because I told Kate out a couple of days ago, I was like, you need to make a conscious effort not to put your hands on your face. I don't touch my face at work anymore. I'm like, because I got to touch too many surfaces.
So, the virus can live up to 9 days.
You better start wearing a mask, or like you have to get up on your zinc and your vitamin C. You around a bunch of sick people all the time.
All the time. So, not a bad idea to, but even if you wear gloves, I mean, it's just such a habit to touch your face, touch your nose, touch your eyes, touch this, touch that.
23 times per hour.
So the average person touches their face 23 times per hour. Per hour. I touch mine about 57.
That's 552 times a day.
That's crazy. I knew it was like 500. So, people, it is getting serious. Prep. Stock up on food and water. We're going to go today. We're going to check out our local Walmarts. We're going to see if they have any more 7-gallon buckets, water containers. And we're going to go get more water. We're going to double up this week. All right. So, just want to come in and give you a breaking news. All right.
She was in her community and that she then did begin accessing care.
The female patient is in isolation at UC Davis Medical Center in Sacramento, and health officials are trying to trace her contacts.
Step by step, we look at where they've been, and who they might have been in direct communication with.
This is the 15th case to originate in the U.S. The other 14 cases involved either people who traveled to China or who had close contact with an infected patient. Thursday, Vice President Pence met with his coronavirus task force. He named Dr. Debbie Bricks as the White House response coordinator.
The president has no higher priority than the health and safety of the American people.
Congress is working on a bill to fund the federal emergency response to coronavirus, and both Republicans and Democrats say now is not the time to play politics.
We're coming close to a bipartisan agreement, and the Congress says how we can go forward with a number that is a good start.
Minority Leader Kevin McCarthy is pointing a finger at the Chinese government.
If China would have allowed our doctors and our scientists in earlier, the world would be safer.
Congress is set to receive a fourth briefing on the coronavirus from the Trump administration on Friday. Skyler Henry, CBS News, Capitol Hill.
John Matteries looks at whether you should try to buy some so you don't waste your money.
Chances are that no one in your neighborhood is carrying the coronavirus. But despite that, worried Americans are stocking up on face masks, causing stores to run out.
These are the kind that, it's a surgical mask.
Amy Hart shows the last 2 N95 face masks she has in her drugstore.
We can't get them anymore. They're out of stock at the warehouse.
Customers like Donna Bruce wonder if it's worth having a few after she recently saw dozens of fellow travelers wearing them flying.
In the airport, you generally see more people with masks on.
Doctors and pharmacists say while a face mask can help prevent you from spreading germs, they say they really don't do much to prevent you from catching viruses, because the main way we pick up germs is not through the air, but it's from touching contaminated surfaces.
Any kind of virus is mostly from hand-to-eye contact, hand-to-mouth contact. So the best thing you can do is wash your hands.
But despite that, people are snapping masks up. We found shelves cleared of masks at this Home Depot store. The nearby Lowe's had just a few sanding masks left.
We get tons of calls every day.
At another family-owned drugstore, Troy Stinson says it's waiting list only.
We should really reserve the masks for people who are sick or immunocompromised.
Which leaves Amy Hart issuing a plea.
I would hope that people aren't just hoarding them, because that's not going to do anybody any good.
Bottom line, no harm in having a few face masks on hand just in case, but please don't hoard them. Help others, and so you don't waste your money. I'm John Batteries, News 3.
Dow Jones Industrial Averages finished today sharply down. The Dow has closed down every day this week thus far, largely due to concerns about the global spread of the coronavirus. Now, we're continuing to follow the spread of the coronavirus right here in the United States.
And the U.S. has confirmed 60 total cases, none in Virginia so far, but health officials are investigating a possible case in Northern Virginia and another in southwestern part of the state.
And as these numbers rise, News 3 reporter Kofo Lasaki takes a closer look at how Centera Norfolk General Hospital is preparing to battle the deadly disease.
The first step to fighting coronavirus is identifying it.
Patients that have presented internationally have developed fever, as well as cough and shortness of breath.
Those are the most common signs, similar to the cold, which makes it tough to pinpoint.
We have a number of negative pressure rooms in all of our facilities.
Like this one right here, it would make sure that none of that contaminated air would get out to the rest of the hospital that could make anyone else sick. Before interacting with the patient, staff members put on a gown that keeps their skin and clothing from being contaminated by droplets. Then they cover their face with a mask specifically fitted for them so they don't inhale any droplets in the air. Next comes the protective eyewear, and lastly, gloves that will keep their hands clean while interacting with the patients.
The mortality rate, at least right now for the coronavirus, is around 2%. So most people are going to have a very mild infection or may not have symptoms at all.
More deadly than coronavirus is the flu, killing around 800 people in the state this season alone. Experts say a key step in protecting yourself from either virus is as simple as washing your hands and doing it often. In Norfolk, Kofo Lasaki, News 3.